The registry has allowed companies to leave their commercial rivalries to a degree at the door, and I think that's given me a lot of food for thought. So where are there areas of the specialty areas of the NHS system more broadly that can allow us to focus on some of the key issues that actually impact both clinical teams, BSG members, that impact patients and impact the companies that are serving those patients and clinical teams. If we can get those sort of things addressed in a collaborative and joint working approach, I think that allows much more fruitful solutions.
We compete on a day-to-day basis. We're going to have our arguments out in the field on a day-to-day basis, but for the good of our patients, let's put forward some of our best people to be involved with the industry working group, to support the industry working group. It's exactly the same as any sporting club putting forward their players to play at a national level.
I think commercial rivalries, whilst they are a reality, can be parked for the benefit of the profession more broadly, and by benefiting the profession, you in turn are benefiting patients.
I've learned some of the stresses that clinicians face on a day-to-day basis, some of the frustrations that they have. I've also learned some of the myths that they have about pharmaceutical companies, and it's changed my perspective in the way that I think about the needs of our patients, the needs of our clinicians and our nurses.
I've been very impressed and gratified by the level of commitment shown by members of the industry working group. There's been a genuine perception that people are putting in extra time, out of hours, own personal time, unpaid, to achieve what they see as a shared aim. And it's been really good to be able to meet up with members of the industry working group around a table, free of the traditional sort of commercial agenda on the one side, clinical agenda on the other, and yet to pursue shared objectives. It's really shown me how creative and how innovative some of the industry working group members can be in addressing some problems which I'd regarded as being pretty exclusively clinical, but had some really good insights.